Hi guys, let's continue our class with the topic delegation. Okay, you know what is delegation, right? Yes. So it's the process for the nurse to direct another person to perform nursing tasks or activities. Okay, so it often involves two persons. The one who is delegating the things or delegator and the delegatee. Okay, delegator and the delegatee. Here, the nurse directs another person to perform the nursing task or nursing activities. Now, let's see what are the rights of delegation. There are 5 rights for delegation. Okay, 5 rights. The first one is right task. You have to choose the right task. According to the Nursing Practice Act guidance, you have to choose the right task. Okay, different board of nursing, they are having different Nurse Practice Act guidance. So depends upon that, you have to choose your task. What are the tasks you can delegate? The second one is right circumstances. Favorable environment or resources must be there. Okay, and the third one is the right person. You have to choose the right person. Depends upon their knowledge or depends upon their competency. And always remember, competency is not the knowledge. Competency involves knowledge, skill as well as education. Okay, knowledge, skill and education. These 3 things involved in competency. Okay, so depends upon the education as well as depends upon the competency, you can choose the right person. Okay, and after that, right supervision. What do you mean by right supervision? You have to monitor the person, you have to evaluate the person, you have to intervene in between in case needed, and you have to give a proper feedback. Okay, so that all comes under right supervision. Then finally, right direction and right communication. Okay, clear instructions. You have to give clear instruction for that person. Verbalize questions. Okay, these are the 5 rights of delegation. Once again, right task, right circumstances, right person, right supervision, right direction and communication. Okay, now let's continue with the scope of practice. Scope of practice of LVN, scope of practice of LPN, scope of practice of RN and UAP. Okay, so let's continue.